Hi everyone, welcome back to Natal Tips. I am Priscilla, your midwife and guide to this incredible journey to motherhood. Today, we are diving into the second trimester, weeks 13 to 27, often called the golden trimester, because it's when most moms-to-be start to feel their best. We will cover how your baby develops during the second trimester, what happens to your body, some common discomforts, and some practical tips to manage them. Most importantly, we will discuss when to call your midwife or doctor in your second trimester and ways to enjoy this exciting phase. Let's get started. The second trimester often feels like the best trimester for most people. For many, the morning sickness and fatigue of the first trimester fades into the past. During your second trimester, you will start looking more pregnant and feel the same. You even find yourself feeling a burst of energy. You will start to feel your baby move around 16 to 24 weeks, and you might begin to settle into your pregnancy and enjoy it more than you did in the first trimester. Let's start with the basic fetal changes that occur in the second trimester. Around this time, your baby has grown quite a bit, measuring about 3 to 6 inches at the start of this trimester and up to about 14 inches by week 27. During this time, the fetus starts to look more like a child, with its facial features aligning and its fingers and toes becoming well defined. By month 4, it will have eyelids, eyebrows, eyelashes, nails, and hair. And fetus will also be able to stretch and make faces and even suck its thumb. Your pregnancy care provider will soon be able to determine the sex of the fetus on an ultrasound, often around 20 weeks. At this point, you might also start feeling the fetus move. People often describe the movement as a flutter or like having butterflies in your stomach. The fetus will move and even do flips throughout your second trimester. Your first movement is called quickening. Although it's often called the easiest trimester, there are still some common symptoms you might experience. Let's talk about 3 of the big ones and some tips to help you handle them. Number 1, back pain. As your uterus expands, your back muscles work hard to support your growing belly. This can lead to lower back pain. A few tips: try sleeping on your side with a pillow in between your knees, and you can consider wearing a supportive maternity belt and stay mindful of your posture while performing daily activity. Number 2, heartburn and indigestion. Heartburn can be more noticeable now as your growing baby presses on your stomach. To ease it, try eating smaller, more frequent meals. Avoid laying down right after eating and steer clear of spicy or acidic foods. A glass of warm milk or some plain yogurt might also help soothe that burn. Some other common symptoms in the second trimester are increased appetite, hemorrhoids, and skin changes like darkening in areas on your face, and also some stretch marks, especially around your breast, belly, butt, and thighs. Also note, there is an increased risk of urinary tract infection, hence good perineal hygiene is important. One may ask, when should I call my care provider in the second trimester? You are the person that knows your body best. If you ever feel like something is wrong, you are mostly in a greater percentage right. So you should call your healthcare provider right away if you have any of these symptoms: unusual or severe cramping or abdominal pain, vaginal bleeding, shortness of breath, or tightness in the chest, which gets worse over time, regular tightness in your lower abdomen or back, thus 3 to 4 contractions in 10 minutes, any fluid leak, either a big gush or trickling, or vaginal discharge, which is offensive. Throughout your second trimester, you should continue maintaining a healthy lifestyle. One of the best things you can do is set aside time for self-care. Go for a walk, try some prenatal yoga, or chat with a friend or loved one. Remember, it's okay to have a range of emotions. You are going through a major change in your life. Apart from exercise, please continue to eat nutritious foods, take your prenatal vitamins, and attend every scheduled prenatal appointment. So that's your guide to the second trimester. It's a time of growth for both you and your baby as you get ready for the next big chapter in the third trimester. Remember to like and subscribe, and also click the notification bell to be notified when I upload my next video. Bye! Love you all and keep staying happy and positive in your incredible journey.